This is the human skeleton, composed of bones and joints, and serves as the framework for the human structure and stability. This function is enabled solely due to its rigidity. When it loses this property, it becomes a problem. And here is a scary fact. Osteoporosis affects over 200 million people worldwide, and most of them don't even know they have it until they break a bone from a simple trip or curve. This condition silently eats away the body framework. Take a look at these images. Of course, you'll be right to think this is normal and this is not what anyone wants. This is the difference between a strong, healthy bone and a bone widowed with osteoporosis, literally meaning porous bones. Today, we dive into exactly what happens in osteoporosis and the simple steps one can take right now to protect oneself. So, what is osteoporosis? You see, bones are static. They are living and dynamic tissues constantly undergoing a process called remodeling. Think of it like a construction crew. Old bone is broken down and new bone is built. With osteoporosis, that balance is disrupted. One is either losing old bones too fast or not building new bones fast enough, or even a combination of both. This leaves the bones weak and brittle, making fractures in the hip, spine, and wrist incredibly easy and common. Overall, the bone architecture becomes more porous, hence porous bones. You might begin to wonder, who needs to be worried about this disease? Osteoporosis can affect anyone and everyone. However, some more common than others. It's particularly common in older adults, especially women after menopause. And this is largely due to a significant drop in estrogen levels, which plays a crucial role in bone maintenance. Other risk factors will include family history of the condition, certain medical conditions like thyroid disorders and inflammatory bowel diseases. Also, medications such as long-term steroid use have also been implicated. But many factors are in our control. Things like smoking, excessive alcohol, and diet dangerously low in calcium and vitamin D have also been identified as culprits to this menace. If one falls into any of these categories, you probably should pay closer attention to the next section. By the way, if you have learned something new about the human body, now would be a good time to hit the like button and subscribe. Now let's talk symptoms. And here is the tricky part. Osteoporosis is a silent disease because in its early stage, it usually has no symptoms. The first real symptom for many is a broken bone. You heard that right. A fracture following a mild fall that shouldn't have happened. This manifests as sudden onset of severe pain in the spine or in the hip with impaired ability to walk. Other symptom one might observe is one getting shorter over time as well as a stooped posture. If any of these symptoms are noticed or you are in the risk category, it's definitely worth talking to your doctor. And then you might ask, how do doctors diagnose osteoporosis? You see, several investigations can be done, like the quantitative ultrasound of the calcaneum, the computerized tomography scanning, as well as the dual energy X-ray absorptiometry. However, the gold standard for this diagnosis is the dual energy X-ray absorptiometry, which measures the real bone density, which is the mineral per surface area rather than the volumetric density. Usually, photos are taken around the lumbar spine and the proximal femur. This modality of investigation is precise, accurate, and uses a low dose of irradiation compared to others. Now to the good news. A lot can be done to prevent and manage osteoporosis. And let's start with the prevention, because it's never too early to think about your bone health. First up is nutrition. Making sure one gets enough dietary calcium and vitamin D is a leap in the right direction, as calcium is the building block for bones and vitamin D helps the body to absorb that calcium. Good sources of calcium will include dairy products, leafy greens, as well as fortified foods. And as for vitamin D, this can be gotten through direct exposure to early morning sunlight as well as fatty fishes and fortified foods. Next is exercise, particularly weight-bearing exercise like walking, jogging, dancing, and strength training are fantastic for stimulating bone growth and maintaining bone density. One should aim for at least 20 to 30 minutes of these exercises for most days of the week. And finally is lifestyle choices. Avoidance of smoking and limiting alcohol consumption have shown to be advantageous as both can negatively impact bone health. For those already diagnosed with osteoporosis, don't worry, there are effective treatments available. Your doctor might prescribe medications such as the biphosphonate, which slows down bone losses, or other drugs that build up new bones. These, combined with lifestyle changes we talked about earlier, can significantly reduce your risk of fractures and improve your quality of life. The key takeaway here is to be proactive about your bone health. If you have a risk factor for osteoporosis or experience any of the symptoms we discussed, please talk to your doctor. They can assess your individual risks and recommend the best course of action. Note, you really shouldn't wait for a fracture before making this move. Strong bones mean strong, active, and independent you for years to come. That will be all for today's video on osteoporosis. I hope this video gives you a better understanding on this important condition. If you found this helpful, please give this video a thumbs up, share with everyone as you might get to help someone benefit from this. And don't forget to subscribe and hit the notification bell for more health and wellness tips. See you in the next one.